Hi William, nice to meet you. How are you?
Not bad, not yourself?
Fantastic, I'm good, thank you as well. I'll get you to close the door and just take a seat.
Yep.
Just here will be sufficient for you. Is it okay if I call you?
That's fine, William is fine, yeah, no worries.
Fantastic. Do you know much about Healthy Hearts then, William?
No, I'm afraid not, I don't know.
Okay, that's absolutely fine. I can give you an overview now. So, Healthy Hearts is a brand new cardiovascular disease prevention service across the Tri-Borough in Westminster, Kensington and Chelsea, and Hammersmith and Fulham. And you've probably been referred to the service via your GP, I imagine, looking at your referral form?
Yeah.
Anyone that has a 10% risk or more of developing cardiovascular disease, which I'm going to abbreviate to CVD, in the next 10 years, is eligible to access our service. There are both modifiable and non-modifiable risk factors for CVD. Modifiable will be things like your weight, your blood pressure, blood cholesterol, etc. And non-modifiable will be things like your age, your family history, and also ethnicity. All of these, when combined together, give an overall Q risk score, and that Q risk score is your risk of developing CVD. So what I'm going to do first and foremost is go through some personal details, and then following on from that, we will do sort of an assessment phase where we'll go through and actually work out what your sort of risk factors are, what's most at risk and what's sort of a lower risk for you. And then following on from that, we can actually work out what programs might be best suited to yourself. So first and foremost then, we'll go through sort of your address, your name, which we've already got on there, and other personal details. So now, what ethnic group would you classify yourself?
Well, I'm white Spanish.
Fantastic. And what GP practice are you registered with, William?
I go to Little Venice Medical Centre.
The purpose of the assessment is threefold. One is to establish a trusting and supportive relationship. Two is to gather information. And three is to offer information.
I noticed on your referral form about high blood pressure.
Yes.
Yeah, and are you taking medication for that?
No, not at the moment.
No? And no other sort of medical conditions or no other medication we should be aware of?
No.
No? Fantastic. Are you working at the moment at all, William?
Yes, I do
Yeah?
work, yeah.
What would be your job title?
I'm a data analyst.
Oh, brilliant. I mean, you haven't got a family member or friend with you today, but as you would have seen on the letter that we sent out, they're always welcome along, either to sort of the follow-up care planner session or even to the first group session programme, if that's what we sort of refer you on to. Just because we find actually the support element of having a family member or a friend with you can actually help you make these positive, healthy lifestyle changes as well. And have you received any treatment or support for a mental health condition in the last 5 years, William?
No.
William, so we've just been through your personal details. Now we're going to move on to the assessment phase, where we will work out what your sort of key risk factors for developing CVD are.
A risk factor is anything that increases or speeds up the development of cardiovascular disease. We concentrate on a number of risk factors, including waist circumference. The amount of excess weight we carry around our waist is a leading indicator on our likelihood of cardiovascular disease. Going on from that, blood pressure is the rate at which your blood pumps blood around the body. High blood pressure means there is additional strain on your heart when it circulates blood around the body.
So William, what we're going to do now is we're going to look at your blood cholesterol readings.
Cholesterol is a fatty substance that causes CVD. Statins are a medication often prescribed to those at high risk of CVD, as it lowers the LDL cholesterol levels in your bloodstream. If you are not on these, we suggest discussing this with your GP.
William, do you smoke at all?
Yes, I do.
You do? How many cigarettes do you tend to have?
20.
Smoking is one of the UK's most preventable forms of death and has a huge impact on your CVD risk.
Called Kick It Stop Smoking service, and by accessing support through an advisor from Kick It, because you're 4 times more likely to quit with the help of an advisor, so that might be something if you'd be willing to do so to give a try. What we'll move on to now is just your alcohol intake. I don't know if you drink alcohol on a weekly basis.
I do.
Okay, what alcohol do you tend to drink?
I tend to have 3 to 4 pints a beer in a weekend.
Alcohol intake can have a large effect on your general health and well-being. including your risk of CVD.
Just moving on, we'll go on to your physical activity now. So in the last 7 days, how much physical activity have you done at a moderate intensity?
Moderate physical activity can be classed as anything that raises your heart rate, makes you feel warm and a little out of breath.
I mean, walking's fantastic, really is good. We wouldn't necessarily classify it as moderate physical activity as such, and we do hope to get people to do up to 150 moderate active minutes a week. It wouldn't be going from one extreme to the other, so you wouldn't go from 0 to 150. It'd be more of a gradual process as such, but that's something we can definitely look into for you through our various programs. The final thing we're going to go through here is just to assess your sort of diet. And what we use is a Mediterranean diet questionnaire to generate a Mediterranean diet score.
Some diets can be defined as cardioprotective or good for the heart, whereas other diets are not so good for the heart. We use a Mediterranean diet score to work out the client's risk.
And what about sort of vegetables? Do you tend to eat much of those on a daily basis?
Probably daily I would say 2 to 3 different variations,
Okay.
but not the typical 5.
And then do you tend to sort of make up the rest of your 5 a day with fruit, or
Just probably just one fruit.
one piece of fruit? Yeah,
Yeah.
so in total sort of 3 to 4 pieces of fruit and veg a day.
Yeah.
Yeah, fantastic. And what about sort of red meat? Do you tend to eat much of that? So things like hamburgers, mince, sort of any red meat
Yeah.
like that at all?
Yes.
Yeah.
Yes, I do, yeah.
And is that on a sort of a daily occurrence, or?
Yes. Yes. it
Yeah.
is,
Okay. So at least one portion of 100, 150 grams on a
Yeah.
daily basis?
Yeah.
Yeah. William, did you receive a questionnaire in the post?
Yes,
at all?
yes, I did,
Yeah.
yes.
Have you got that with you?
Yeah.
Thank you. And you completed it at home?
Yes, I have.
Fantastic. So this is a Wellbeing HADS questionnaire.
We also look at your mental well-being. Often those struggling with anxiety, stress or depression can be at additional risk of cardiovascular disease. We calculate your mental well-being score through a HADS test. That's the Hospital Anxiety and Depression Score.
William, we're going to discuss barriers to change now. So you mentioned earlier that you do lots of walking, which is fantastic.
We discuss barriers to change with the client. This gives us an idea of how we can best help the client achieve their goals.
And also with time, if you think that in a week there's over 10,000 minutes, and we ask you only to be active for 150 of them, it sounds like quite an achievable goal in that regard. You also mentioned that you were smoking sort of 20 cigarettes a day. Have you thought about quitting before?
Yes, several times. Yeah.
Okay, fantastic. So great that you're sort of in that sort of contemplation phase. What's actually stopping you from sort of stopping smoking at the moment?
Well, it's really hard. I mean, every time I try, to be honest, I don't tend to last more than 3 days. And on top of it, it's just when the weekend arrives and, meet up with some friends and so on. This is something that it's really hard to quit after this, really.
Okay, so again, it's a sort of social situations for you. And I think actually by accessing support at Kick It Stop Smoking service, you'd be 4 times more likely to quit, and having the accountability of an advisor and that going through carbon monoxide readings, you can see the visual element that keeps you on track and helps you to quit smoking. So you can tell actually just how sort of confident you are and how keen you are to give up smoking, which is fantastic. And I think actually the support of the advisor would be really beneficial in your case. And just the other thing, you mentioned that you have in sort of maybe up to 3-4 portions of your 5 a day, so fruit and vegetables. Is there any reason why you can't have 5 or more portions a day?
Well, maybe because I don't cook. Maybe I should try to learn or something. I don't know.
Okay, so you're really interested in sort of learning how to cook then?
Oh yeah.
Okay,
If
so
it helps.
So is it something you want to learn how to cook?
Yeah, I mean, it will probably change my way of eating habits.
Yeah, so you just haven't had the opportunity to as such before. Okay, brilliant, because something like Cooking Equals would be fantastic for you as well, based on what you've told me, William. And then sort of my final sort of question around barriers to change would be, if on a scale of 0 to 10, with 0 being not confident and 10 being very confident, how confident would you be in sort of making positive, healthy lifestyle changes going forward?
Well, to be honest, I feel like an 8.
Okay.
Yeah, that's why I'm really here, to be honest.
fantastic. Great to hear, and great actually that you're so keen and so motivated to change. And based on what you've told me, we've got loads of programs that would be, or we've got a range of programs that would be fantastic for you to help reduce your risk of developing CVD. So William, we've identified what your key risk factors are. So what we're going to do now is look at different programs available to you that may help reduce your risk of developing CVD in the next 10 years.
We can offer the client several ways in which to help them. We have a Lose Weight with Healthy Hearts programme. This is a 10-week weight management programme which gives practical information and support to help the client lose weight. Each session is an hour and a half, including a 30-minute exercise component. The programme looks at different topics each week, such as portion sizes, snacking, getting active and drinks. Another is Healthy Hearts Active Clubs. We have a number of beginners activity classes running across the Tri-Borough. The first 6 sessions are free and each weekly session lasts for 1 hour. Activities on offer include begin to swim, begin to gym, health walks and walking football. Our club menu is growing all the time. Healthy Hearts Cook and Eat programme is another programme that can be accessed. These 6-week beginners cookery classes are held in various community locations across the Tri-Borough. Each week's ingredients are provided and the groups cook up and eat healthy, affordable and easy to make meals each week. Recipe cards for what has been made are also provided. Our Healthy Hearts service works closely with our sister service, Kick It, to help clients stop smoking. We also offer specialist clinics. Healthy Hearts provides specialist one-to-one clinics for high need and complex clients throughout the specialist programs. Self-help materials are on offer for clients struggling with issues like stress, anxiety and depression. There is also an option for clients to attend group sessions focusing on stress and anxiety. There are a number of local alcohol support and treatment services available in the Tri-Borough area. Healthy Hearts care planners can, if appropriate, access these services for the clients. At the end of the session, the care planner will ensure the client fully understands the plans that they have developed together. They will also book an appointment for the client to attend an end of programme assessment. This is to monitor their progress and signpost them on to other services to maintain their achieved goals.
And the final thing I want to give you is just a letter here which gives you a bit more information about the service and what you will be accessing. Is that okay for you?
That sounds brilliant.
Have you got any other questions?
No, that's fine. I
at
hope
all?
I don't disturb you so much.
Yeah, fantastic. Well,
Thank
nice
you
to
very
meet
much
you,
for that.
William, and good luck with the programmes.
Thank you.
Okay, speak soon.